And Amanda, who was our fourth born, during the summer of 2012, went through a series of just getting sick. And we thought she had the stomach bug and, kind of waited that out, and it didn't go away. And we finally took her in October. The doctor kind of finally came to the conclusion that she needed an MRI. So we took her in for an MRI, kind of knowing with a pit in our stomach that this was likely not going to be anything good, because we knew just from how things had unfolded up to that point, how she was looking with her own health, that this might not be news we would want to hear. And so we went in for the scan, and she wasn't even out of the scan when our pediatrician called us and told us that they did find a brain tumor in her brain, and she would be admitted to the hospital, and we'd get more information as the days and weeks unfolded. So we were in the MRI waiting room when we got the news. And there's no other way to say it than your life changes in an instant, and suddenly you have more questions than answers. You don't know anything that's going on, and you don't know anything about brain tumors or childhood cancer. So we were kind of in a state of shock. She was admitted to the hospital. They had her there a few days before they did brain surgery. It was very successful. She had a total of 10 days that she was admitted into the hospital, and then she came home and she started a 33-day radiation treatment. And we were told that, if the surgery is successful and she goes through radiation and everything is clear and she stays clear, good prognosis. But if it comes back, that it would be very bad. And we were very hopeful, very enthusiastic in those first few weeks. And she went for a 6-month scan, and we found out that the tumors were back in her brain and in her spine. And so 6 months from diagnosis, we kind of knew that things were not going to be good for her, things were not going to be good for our family. And it was kind of at that point where we really did start the process of understanding what that meant for our family. And so she went through more treatment, more radiation, ongoing chemo for another year and a half. She was in treatment a total of 2.5 years, but she did in February of 2015 passed from the cancer. And in the very first few days that we were in the hospital, there was a social worker there, a great, incredible social worker, who kind of said, I'm going to get you connected with this right away, and the sooner we do it, the better. And she, we didn't know what it was. We said, all right, whatever's going to help. So before we were even out of the hospital, actually, we were somehow connected. Shortly thereafter, a social worker came to the house and kind of started the process of explaining what CompassionNet could do and how they could help. When this all first started to unfold, you don't know what you need. You don't know how your family's going to hold it together, how you're going to manage appointments. And so they were able to step in and provide a lot of supports that we have been invaluable from the beginning, from the get-go.
There's a support for all the family members in addition to the patient. So for our other 4 children, it was an art therapist or just professionals whose job it is to work with children who have a sibling going through cancer. And so just providing that expertise to our children and helping them make sense of it all and just kind of have a place in the journey, and that they get a specialized support. Because Liz and I are really dedicating our primary focus to our sickest child. When you know that your child has a terminal illness and that there's going to be a window of time where the end is coming, there really is very few people that you can lean on to make through what I would say is one of life's most difficult challenges that few of us have to go through. So that second strand of having a support team, palliative care for children, right? That chunk of time, having experts there to let you know that they're there and that they've been through it with other people, provided a comfort. I'm not sure what the right word is. I don't know if it's comfort, but kind of an assurance that you're going to make the best of a really, really difficult situation. To me, that's what is very impressive about the CompassionNet model, is that it really doesn't focus on the sick child. It focuses on the people who need support so that they can help that child. And that it's, the doctors, the oncologists, the surgeons, they are there for Amanda. And medical insurance pays for that, right? But then that web of support to stay strong, really, we need things like CompassionNet for families and for the family members who are helping the patient.
CompassionNet made one of the most difficult, undoubtedly the most difficult time in my life, a little easier, a little lighter. There were details I didn't have to worry about. There were things that were taken care of for my children that when they worked with a child life specialist, they created art or they created things that I would look at and go, I would never have done that, but I'm so glad that we have that now. I mean, just ways that I guess at the end of the day, I felt a little lighter. There was a time when I sat on my front porch with a nurse and cried and said, I don't know how I'm going to do this. And she held me and explained and just said, it's going to be okay and you're not alone. And at the end of that, I sent a message and I just said, I feel a little lighter now. Thank you. One of the things that stands out to me is Emily, our youngest, who was under a year when Amanda was diagnosed and was just shy of 3 when Amanda passed, may not have a lot of memories of her sister. We have photographs and we have things that we can point back to, but one of the things that she's been able to do is work with a child life specialist and create a book about the two of them. Take some of those pictures and put them in special jars with a light or a candle in it so that, they've got things that you can't deny. Tangible things you can hold that says, this was real and she really was my sister. And maybe I don't have that memory because I was 3, but just some beautiful ways that she'll be able to carry that through.
It really is important the way that CompassionNet establishes relationships throughout the process, and especially if you're a family that ends up going through bereavement. Having those connections before the child passes really makes a difference, I think.
Is that grief is so complicated. It's not a straight path and you can pick up a book and it tells you what to do. I mean, we went through a lot of different struggles with the different kids because they were all dealing with it differently. I mean, therapy for one worked, but therapy for another one was really a horrible choice. But we were able to work through all of that, talk to CompassionNet, talk to our social worker, and really find what was going to fit for each kid. One kid maybe needed a better focus on art. Another kid needed focus on music. There were so many options and so many ways to help us when we're like, I don't know what to do. I don't know how to help this kid. I mean, I was pulling out my hair just wanting to let them know that however they're feeling is okay, but I didn't know what to do. And so that was just such a huge help. A deep breath made me feel a little lighter to know that the kids were all getting what they needed, not just a rubber stamped, here's what you're gonna get. It was really personalized for every kid. Every kid's gotten a little something different, so.
We had to start thinking about where is Amanda going to pass away. And so we had Dr. Coronis and Nurse Julie, Bean, administering pain medication, making sure that all of Amanda's medical needs were being met here at home. And having spent as much time in hospitals as we have, that's not that clinical environment is not where you want to spend that time in particular with your child and your family. We had complete support and coverage medically, emotionally, and it was with a team of people who specialize in this. And that is invaluable. You're going through it, and you know that everyone's experience is unique and that it's heart-rending tragedy. But knowing that somebody else or a team has helped other families through this gives you the assurance that you're going to get through to the other side as good a way as possible.
When this was kind of presented as a possibility, I really couldn't imagine anything else with the other kids here. They were so much a part of her journey along the way, so much a part of her treatment, that of course they would be here at the end. And Amanda hung on for 6 months, or 6 weeks, I apologize, much longer than we expected. And she was here in the house the whole time, and we held her 24/7, whether we were on the couch or up in the bedroom. And if we needed anything, if Amanda was at all uncomfortable, a nurse was a phone call away, and they would be here within minutes. And then especially at the end, we were not alone. We were not alone. We had nurses that we had gotten to know, that knew Amanda, that knew our kids, that were here. I was actually thinking about the moment Amanda passed. Everyone in the house had fallen asleep. We had been up over 40 hours, just waiting, knowing, watching, sitting vigil. Paul was holding Amanda. He fell asleep. And I sat there talking with the nurse, and I was exhausted, and I finally fell asleep. And it was while the whole house was quiet and everyone was asleep that Amanda finally passed. And I think that's how she wanted it. I think she wanted us all here, but she wanted us all peaceful. And I think the only reason that we could sleep was because there was a nurse sitting in a chair 3 feet away that didn't take her eyes off of Amanda the entire time. And so I know that she was cared for in the very best way possible. I know having us holding her was all she ever wanted. And so I have no regrets about how all of this happened. I would never want to do it again, but I would do it again the same way in a heartbeat.